Hi everyone. Today we're going to talk about the prescription medication referred to as Zoloft by the brand name, or sertraline hydrochloride. That is kind of the off-brand generics. Uh, and we're going to just walk through like we did for Valium or diazepam, give you as much information as possible. So when we're taking any type of antidepressant, it could cause serious side effects. If any occur, definitely call your healthcare provider right away if you have any of the following, or call 911 if it is truly an emergency. So the first thing is, suicidal thoughts and actions. So Zoloft, sertraline, and other antidepressants may increase suicidal thoughts or actions in people 24 years of age or younger, especially in those first few months of treatment, or if the dose is increased or decreased. Depression or other serious mental illnesses are the most important causes of suicidal thoughts and actions. So you want to watch out for these changes. Call our healthcare provider right away. If you or somebody you know sees new or sudden changes in mood, behavior, actions, thoughts, feelings, especially if they're severe, and pay particular attention uh, to changes when the doses are changed, because that can have an effect. Keep up on all your visits with your healthcare provider. That is to check to make sure you're taking the right dose, your thoughts and your feelings, and that's something that I do with my mental health. So when do we call our healthcare provider if the following symptoms come up, or call 911 if there's an attempt to commit suicide, acting aggressive or violent, new or worse depression, feeling agitated, restless, angry, or irritable, thoughts about suicide or dying. So that is an action. Acting on dangerous impulses, new or worse anxiety or panic attacks, trouble sleeping, an increase in activity or talking more than what is normal for you, and other unusual changes in moods and behavior. So serotonin syndrome is another thing we want to look out for. And this is a condition that can be life-threatening, and the symptoms include agitation, hallucinations, coma, other changes in mental status, racing heartbeat, high or low blood pressure, coordination problems or muscle twitching, overactive reflexes, also nausea, vomiting, diarrhea, sweating or fever, or muscle rigidity. There's an increase of bleeding that can occur while taking this particular medication, especially if you take a blood thinner like warfarin, also called Coumadin and Jantoven, a non-steroidal anti-inflammatory drug, which are referred to as NSAIDs, like ibuprofen and naproxen or aspirin. Manic episodes, symptoms of those are greatly increased energy, racing thoughts, unusually grand ideas, severe trouble sleeping, reckless behavior, excessive happiness or irritability, talking more or faster than usual. Seizures and convulsions can also happen. Glaucoma, which is also referred to as angle closure glaucoma, uh, that can definitely affect us if that happens while taking this medication. Changes in our appetite or weight. Children and adolescents should have height and weight monitored during the treatment. Low salt or sodium levels in the blood. Elderly people are most greatly at risk for this. And those symptoms are headache, weakness, or feeling unsteady, confusion, problems concentrating or thinking, and memory problems. Sexual problems or sexual dysfunction. So taking serotonin and norepinephrine reuptake inhibitors, also called SSRIs, including sertraline hydrochloride slash Zoloft, may cause sexual problems. What that can be in males are delayed ejaculation or inability to have an ejaculation, decreased sex drive, problems getting or keeping an erection. For females, that would be decreased sex drive, delayed orgasm, or inability to have an orgasm. If that happens to you or somebody you know, reach out to your healthcare provider. If you have any questions about that, there may be alternative treatments your healthcare provider can suggest. Do not stop taking this medication without first talking to your healthcare provider. Stopping it too quickly may cause really serious symptoms like anxiety, irritability, high or low mood, feeling restless, or changes in sleep habits, headaches, sweating, nausea, dizziness, electric shock like sensations, shaking, and confusion. So, what is Zoloft slash sertraline hydrochloride tablets best used for and what they're treating? Major depressive disorder, MDD, panic disorder, social anxiety disorder, obsessive compulsive disorder, OCD, post-traumatic stress disorder, PTSD, premenstrual dysphoric disorder, PMDD. And it's very important, again, just to keep in contact with your healthcare provider, talk about these risks of treating depression and then the risk of not treating it. And we want to discuss all changes and all treatment options and choices with your healthcare provider. These tablets are safe and effective in treating children with OCD ages 6 to 17, but it's not known if these tablets are safe and effective for us to use in children 6 years of age and under with OCD or children with other behavioral conditions. Who should not take Zoloft and slash sertraline? If you take an MAOI, you want to ask your healthcare provider or pharmacist if you are taking one, including antibiotic linezolid. If you've taken an MAOI within 2 weeks of stopping Zoloft, sertraline, unless directed to do so by a healthcare provider, take any other medicines that contain sertraline, take any antipsychotic medicine, ORAP, because this can cause serious heart problems. If you're allergic, obviously, to the ingredients, that can have a negative outlook on that. If you're taking Antabuse, disulfiram, if you're taking this liquid form of sertraline hydrochloride tablets due to the alcohol content. If you're taking an MAOI with these, you can have threatening side effects like high fever, confusion, stiff muscles, loss of consciousness, rapid changes in heart rate and blood pressure. And before you start this particular medication, tell your healthcare provider if you have liver problems, heart problems, bipolar disorder or mania, kidney problems, if you've had seizures or convulsions, low sodium levels in your blood, a history of stroke, high blood pressure, or have had bleeding problems. If you're pregnant or plan on becoming pregnant, or breastfeeding or plan to breastfeed. And especially, we want to share those other vitamins and herbal supplements we're taking as well. And we want to take these as prescribed. We don't want to take too much. If we do, we want to call our healthcare provider or the Poison Control Center, and we should avoid the ability making decisions or thinking clearly. We shouldn't drive until we know how this will affect us. So a lot of information on Zoloft and sertraline. Check back with us at a later date for more.